Hi, I'm Christy Call, Editorial Director of Cure Magazine, and on this week's Speaking Out video series, we have Lisa Schlager from Force discussing breast implant-associated lymphoma. So now we'll be discussing breast implant-associated cancers, which has been a big trending topic recently with an FDA hearing this past year. Can you offer us just some basic background in case our audience doesn't know what happened this past year?
Absolutely. So to give some history, last March, the FDA held a 2-day meeting to review the safety of breast implants and also the mesh that's often used for implant-based reconstruction after somebody has had a mastectomy. It drew attention from not only the US but worldwide. And the goal of that hearing was to explore some new research and increased awareness around a condition that occurs in women, a small percentage of women who have implants. Specifically, they thought initially was textured implants. They now believe that some women with smooth implants may also have this issue. And it's a breast implant-associated lymphoma. And the truth is it only occurs in women with implants. It's almost like a man-made lymphoma. The estimates are that this occurs in less than 1% of women with breast implants, and certain implants seem to be more prone, these textured implants. So the FDA reviewed the data, brought in some of the world's top breast implant manufacturers, and evaluated the safety of these products for the US population. It's important to note that this is specifically focused on the US through the FDA. The European safety issues are managed completely separately under their own healthcare systems. So, and they do have different products in the US versus in Europe, so we have to differentiate. But so that March hearing yielded some new recommendations and some announcements around breast implants. Specifically, Allergan was asked to recall all of its textured breast implants. And textured implants were sort of the new fangled thing in some ways, but because of safety concerns, they've basically pulled those off the market and attempted to raise awareness around this type of implant-associated lymphoma among women with these implants. They are not recommending that women who have the implants and who do not have complications go out and have surgery to remove them. They're actually advising that they're perfectly safe as long as you're not having any symptoms, but if you obviously are having symptoms, you should see your surgeon to be assessed for potentially removing those implants.
Okay, so you mentioned that the textured implants were kind of the new rave. Why is that?
Supposedly they potentially gave better results because of the texture. They gave better cosmetic results. Okay. I do think it's important to note that these implants are used not only for breast reconstruction, but also for augmentation. So we really have an interesting dichotomy of women who've done this for cosmetic reasons, as well as women who've done it for breast reconstructive reasons.
Right. And cost might be something that comes into play. Are there any laws that are requiring coverage, or does
Great question.
insurance cover it?
So the Women's Health and Cancer Rights Act is a law that requires insurers to cover breast reconstruction for any woman for whom they would cover a mastectomy, whether or not she had cancer or did a risk-reducing mastectomy because she was high risk. So in addition to covering that reconstruction, the insurers are legally obligated to cover revisions or any sort of complications that occur. So in fact, they should be covering removal or replacement of these implants if a woman does encounter issues. Where we are occasionally encountering problems is if a woman isn't having complications, but she feels uncomfortable keeping the textured implants. Sometimes the insurers are giving some pushback, but for the most part, we are seeing the insurers are covering this. On the flip side, women who have done this for augmentation are having significant issues getting insurance coverage because the insurers did not cover the augmentation to begin with. And I know some people have approached Allergan with concerns about covering those costs. And I know they're covering the cost of replacement implants, But of course, there are far more costs than that because you have to go through surgery to remove or replace these. So it's something to think about, but any woman who has these implants should absolutely talk to her plastic surgeon about it to see if replacement is advisable. The other thing to look for is symptoms. So any sort of swelling or fluid or change in shape of the breast, that is a warning sign. And so if you have any concerns like that, absolutely seek out professional expertise from either your breast surgeon or a plastic surgeon.
Right. So we talk about, coming in as an informed patient as best you can. What are some resources that women can access so that way they can have these discussions with their plastic surgeons?
Great question. So every breast implant comes with basically an informed consent and also some sort of pamphlet that gives an overview of the benefits and risks of breast implants. What we've heard from a lot of women is either they weren't really given that information or they just sort of glossed over it because it was 30 pages of 7-point font. And so one of the things that we're working on with the FDA is a better type of informed consent. And one of the things the FDA just did was they put out a draft guidance that focuses on some improvements. One would be having a checklist that goes with the informed consent so that the woman and her doctor have more of a conversation about the different pros and cons and benefits and risks of breast implants so that a woman goes into this with the most information possible. And among the things on that checklist is my surgeon has discussed alternatives with me, such as no reconstruction or doing a flap surgery and using my own tissue for reconstruction. Now that may not be an option for everyone, but at least it's important to have that conversation with the doctor. There are different types of implants, so you want to understand specifically what type of implant you're getting and if there are any specific risks around that. The other thing the FDA has proposed is actually a black box warning. A black box warning is reserved for some of the most dangerous, potentially most dangerous drugs that we have. It's the first time we're seeing one recommended for a device like this. It's an interesting concept. I think my concern is a lot of patients don't see the box that their implants come in. But there is an opportunity to comment on this, and the industry as well as the cancer community is giving feedback, and so the FDA will evaluate all of that input and make a decision.
Okay. And so if somebody does have concerns that maybe they are at risk for this disease or they think maybe there's symptoms, what are your recommendations for next steps?
Well, first and foremost, there are certain types of people who might be predisposed to complications from breast implants. These might be people who have autoimmune diseases or maybe blood flow problems. And that type of information is typically outlined in the surgical information when they're considering the breast implant. I think it's also important if a patient isn't feeling confident in the information they're getting from one plastic surgeon, they should seek out a second or third opinion to make sure that they have the most information possible to make a decision. That said, if a person ultimately does experience issues, the first people to turn to are your healthcare provider. And then it's important to register your implants. Believe it or not, just like your toaster, you should register your implants with the manufacturer so that if there's a problem, they can contact you and there can be follow-up and dialogue. And that's really important so that women can have the information should there be a recall or other sort of complication.
Great. Well, thank you so much.
Thank you. Appreciate it.